All right, hello again, Patrick. So we're standing in a different suite here on the East Bank, and this is one of our remodeled suites. Similar to our other one when we were talking about MRI and different efficiencies and safeties that can be gained. This room is one of our rooms that we use for robotic surgery. So you can see our Da Vinci, the consoles, and we have over here is actually when I talked about the dual console and the ability for surgeons to be able to sit at one, proctor someone at the other. And some of the uniqueness is not necessarily just in robotic surgery, but the effects we have on patient outcomes and overall savings. So when you think about pieces of equipment like robotics and the idea of, do I invest in an MRI? Do I invest in robotics? Very costly capital type equipment. So we're talking hundreds of thousands of dollars just for equipment. And then you think about what are the types of rooms they can fit into, because these types of pieces of equipment, if you go into, do have some older rooms here that are not remodeled at this point. From a square footage standpoint, you'd feel pretty cramped. And then you get into that conversation of, are we risking sterility and those types of things when you try to jam people into a small space? So we're very fortunate that we went through a major remodeling project here. It allowed us to use our equipment more versatile. But in addition, when we talk about efficiencies, spending this much money on the front end to regain that cost is going to take a lot of time, a lot of intervals of patient care. But the unique thing that we find is, as a system and as healthcare, we continue to share those learnings and say, if we invest in this piece of equipment, what will it do to overall savings or cost in the OR, but also on the post-operative perspective? So will we reduce pain if we do it with robotic as opposed to laparoscopic, as opposed to open? You might reduce pain and you say, well, that's great. Well, people can tolerate certain levels of pain. But at the same time, you think about, are we going to be giving that patient more medications? So there's a cost to that. So it's not only the comfort for the patient, there's a cost to the patient. We think about length of stay, which I'm sure you'll talk about if you haven't already. Does the investment of this hundreds of thousands of dollars decrease length of stay? And you don't always judge length of stay by weeks or days. A lot of times you're looking at, is it a quarter of a day? Is it an hour difference? But across thousands of patients, that's why equipment or capital investments like this make sense, because we can have better pain control, which means less narcotics, also that risk for long-term narcotic use. And we can decrease length of stay, which is a win for the patient. But as we know, usually what's good for a patient many times is good for an institution, as we are stewards to everything, the resources and our patients. If we can decrease their length of stay, decrease their pain, it'll save us money as well. We can look at post-op complications. Are complications going to be higher with open surgery, laparoscopic surgery versus robotic? When you can prove that you have less complications, you think about return visits, whether it's clinic, but readmission rate. So you also can look at those things from a cost-saving standpoint, which helps you drive some of those decisions of, is the capital investment worth it? So very fortunate, once again, I talked about a little earlier, 12-hospital system, pretty unique to be able to share those learnings. In addition, we're part of cohorts throughout the nation, academic centers that we're sharing learnings, because it could be something as simple as, do these gloves work, to do these robotic machines work? So just a little extra for you on that.